Welcome to Exercise Programming for Special Populations. This is Chapter 1. Let's get going. Just waiting on the computer to respond. It's being really terrible today. Been asking for a new computer for, nearly 2 years, 3 years now. I don't know what's going on. It just gets worse, but oh well. I think something's happening. Let's see. Maybe it's gonna go. Moving slow, moving slow. Still spinning. Something's happening. Don't know if it's good or bad. Come on. And there we go. All right. Let's skip past objectives because we'll hit those as we go. If it'll let us skip. All right, special populations. Despite physical and psychological benefits of exercise, participation is not always a given for all people. We'll get into that in just a minute. Because the limitations or characteristics, certain groups of individuals or special populations may require altered exercise programming supervised by specially trained exercise professionals. Again, there are certifications in special pops. NSCA has one. I believe NASM may have one. ACE may have one. Again, I always encourage you guys to get NSCA, as this book is an NSCA book. You'll see it's a great book to go through this material. So again, it's different than working with quote unquote healthy population. There can be some different challenges depending on which group or types of special population folks that you work with, okay? They're individuals with chronic disease or disabilities, as well as groups that differ from the overall population with regard to age, so youth and elderly, or specific conditions related to gender, female triad, and pregnancy. So again, like you think of something like pregnancy or the female triad, those are things that can come and go. You know, pregnancy lasts 9 months. So you may be working with somebody that's quote unquote normal population. Now she's pregnant for 9 months. There's special population considerations that you would take with helping that woman exercise. After pregnancy, there's a time at which she won't exercise, and when she gets back, she's still going to be under some certain considerations. But then she'll get back to where she can resume her normal routine she was doing pre-pregnancy. Right. Same thing with female triad. You know, depending on what happens with bone mineral density, their body weight percentage and things, as those things get better over time, you may be able to work with them under different conditions. Youth, you just got to wait for them to grow. Elderly, we can't reverse them. So, you know, that is what that is. And again, if you work with folks that have either mental disabilities or physical disabilities due to congenital issues or things like, you know, accidents like car accidents and things like that, there are certain things that you won't, you know, they're always going to work with in that. And then again, chronic diseases as well. Okay. So treatment of disease has typically focused on curative efforts and lifespan extension, but more palliative approach with emphasizes treatment of the consequences of the disease, reflects a focus on quality of life. Again, a lot of people think when they have a disease that, it's like, oh, fix what you can fix and my life is what it is. But again, there are a lot of things you can do with certain diseases. Again, we have very active type 1, type 2 diabetics. Again, both diseases are very different in how they onset and what causes them. But again, working with those different populations, there's just things you've got to work with and work around, and they can live very active, healthy, fun lifestyles. Folks that have had heart attacks, folks that have had strokes, folks that, have been in and out of cancer, and so on and so forth. And again, it increases their quality of life, right? Exercise represents a palliative approach to disease treatment, but opportunities and access to training may be limited for special populations. Again, we have more and more folks going through exercise sciences, but at the same time, if you've never worked with these populations or you're not trained to work with these populations, there's not a lot of opportunity. You think of a lot of small towns, there's probably some gyms in some small towns that actually have nobody with any education. They all have some certification, that's it. And really probably would do a poor job with working with some high risk individuals. And so then they just don't, or those folks don't seek anybody out because they don't know where to go or they can't find anybody, so on and so forth. So again, another reason I tell people it's very important that we keep having exercise science majors out in the public working. And again, I'd like to see you guys squash out all these uneducated folks that come out of high school and just go get their certifications, because there's a lot more that you can bring to the table with your education, understanding how the body works, how nutrition works, understanding, that you just can't always push through pain, no gain, and those type of mentalities don't work. Right. And that we've got to have educated folks that can, sometimes work with somebody that's had like a serious knee injury and say, look, I get it. You're not going to do squats to that ankle, right? We're not going to get, your butt's not going to be touching the ground, like you might see in a CrossFit gym or something like that. And again, not picking on CrossFit, that's just, it's kind of a somewhat of a truth and stereotype at the same time, but there's some good CrossFit trainers out there too that say, look, I know we typically have folks get to this point, but under your circumstances, here's where you squat to, or you don't squat at all. If we do these other leg exercises instead, right? And so having folks that can recognize that and still help people live healthy lifestyles is huge. All right, benefits of exercise: disease reducing benefits, reduction of body weight. Again, a lot of times being overweight and obese, maybe the cause of your issues, or maybe it's a result of some other issues going on, but it still makes your life harder. Again, you get to a lighter weight and things like that, your body might feel better, whatever it is. Decreased blood pressure. Again, that's a whole gamut of what if questions in that. Decreased blood pressure, those that have high blood pressure or improved lipid profiles tend to occur with increased exercise, improved resting blood sugar levels, improve body function, increase muscular strength and endurance. When you have more strength and endurance, there's more things that you can physically do, right? If you were tiring easily doing certain, like whether it's recreation or work, more endurance helps. If there are certain things you couldn't do because you didn't have enough strength to do it, muscle strength helps, right? Reduction in risk of falls in older populations. Again, when you have a lot more strength and endurance, there's less chance your muscles will fail you. Again, when you're doing training that requires you to move in different directions, requires you to increase your balance and stability and things like that, because you're moving and doing all these things, there's less chance you're going to fall. Right? Improved mental health. There's so many studies on the benefits of exercise and cognition and so on and so forth, as well as the fact that there's a lot of things that show the psychological benefits as well. So you got the neuroscience benefits, and then we've got the psychological benefits in increasing mood or improving mood, decreasing depression, decreasing anxiety, so on and so forth. Yeah, I mean, exercise is just one of those just amazing tools that a lot of people just don't use to improve their overall life. And again, improve physical work capacity. Again, that helps you in both, like maybe your work and also your recreational focuses or things that you find fun. Benefits persist across ages, genders, training status, current health. Exercise program needs to be designed specific to where you're at and who you are and what you're dealing with so that it's safe and effective for each given special pop. So again, the if I'm doing little kids and I'm trying to help them to become better athletes or something, right? I can't have them doing the same lifts that I would have a 20-year-old experienced college basketball player, or I can't have, like college basketball players. I am guys and girls doing like, like, pretty heavy Olympic lifts or doing some agility stuff that takes a lot of skill and training, where a 6 or 7-year-old doing those things, and again, not because their body can't necessarily do it, but they can't comprehend how to do those things correctly and know, like how, they may not have the capacity to learn the movements correctly, in the agility work or the Olympic work, where they could do it safely, effectively and safely. Again, you may find some 6-year-olds or 7-year-olds or something like that have the mental capacity to do some of those things. And so, yes, you can add those in. And again, it gets to that whole, we tailor programs for the individual, right? But again, sometimes you may work in groups and you've got to tailor the program to where the group is along the, least common denominator of trying not to get anybody hurt, right? Inactivity and causes: only 15-20% of adults above 18 exercise regularly, resulting in greater incidence of chronic disease, increased costs associated with healthcare. Again, we talk so much about healthcare in our society, and one of the greatest things that we have that helps you in healthcare is being able to exercise, and just make it a part of your daily habits. Make better choices when it comes to how you eat. Again, we won't get too much into that in this particular book, but again, the amount of chronic diseases and healthcare costs and things that we see based on poor behavior is just astounding, right? And activity arises from both individual and societal origins. Again, there we could go over all kinds of different things, and so when we meet in class, or actually we'll do this one over, over Kaiser Live. We can talk a lot about those things, but we won't go into too much depth, since I'm talking to myself on this one. Um, Societal causes of inactivity: technological advances that reduce work. These have been some of the biggest shifts that we've seen over the past century. If you just take the last 100 years, you see great changes in the type of work that's been done. Even in industries that have been around for over 100 years. So you take farming, the amount of physical activity that was in farming in the past versus now has shifted quite a bit. You look at office jobs, right? Look at, think about a secretary. Even over, like if you think about since maybe like the 1970s or 1980s, when we weren't as computer dependent, right? So you have somebody that greets people as they come in the door, hands them paperwork, answers the phones. They would then take all that paperwork, they would go put them in physical files. A lot of times the filing is not right there at the desk, so they're walking around, they're putting files, all, in filing cabinets, or, they may have those big filing walls at like some of the old doctor's offices. And they're physically getting up and doing all those things, right? And then they got to, take the files to the doctors and so on and so forth. And everybody's walking around doing all these different things. Doctors got to go look for files and so on and so forth. Now you take that same office today, all that's done over the computer while they sit, right? There's not as much physical movement required in that particular job as it was before. Um, so we see that in farming, we see that in office work, we see that, right? Change in community development to urban sprawl instead of small self-contained communities. Again, it's, the way that we've grown cities, the way that we've grown this country, and the increase in folks, and the even in the sense, you can look at how shopping and things have changed. Especially now during everybody does online, right? You don't even have to go to the store anymore to go grocery shopping or go shop for clothes or whatever else. You can have it just delivered to you, right? And so even our self-contained communities have become global self-contained communities in a sense as well. If that makes sense. I mean, I know in my head what I'm thinking, but let's see if it'll go to the next slide. It doesn't want to. Come on. Apparently I spent too much time on this and now it's stuck. Well, okay. Increase in percentage of population over the age 65. These individuals are usually less active. Thank you, boomers. Oh, let's go back. Come on. Back to the last slide. I know this thing's thinking, but not really thinking. Reduced outdoor play in public schools. Again, I used to have PE every day when I was in elementary school. I notice in elementary schools now they usually have a day, maybe 2 days where they have PE. The amount of recess time and activity that they get during that is less than it was in years past. Again, part of it's because we do so poorly in science and math and technological things and compared to other countries. So our school has tried to focus in that, even though any of you that try to do Common Core math, if you have kids, you will quickly realize that the mathematics we're teaching is not helping. They've tried to simplify it in a way that makes it take like 4 times as long to do, instead of just getting our kids to learn how to do math the most direct way, which I don't understand why we do that. Apparently the quickest path between 2 points is not a straight line anymore, according to Common Core. But again, but a lot of those things have forced schools, I guess, in a sense, to reduce outdoor play and things like that. Prior generations usually, 2 parent households usually had 1 parent working and 1 parent at home, which would allow more time for the kids to be outside playing and being active and things like that. Now, a lot of times kids are at little, they stay in little daycare things, where they, after school until mom and dad get home. By the time they get home, they got a lot of homework, not as much playtime as they used to have, or in the fact that we have a lot of single parent homes, which again doesn't allow a lot of playtime. Perceived lack of time or convenience in an activity. A lot of people just don't feel they have the time. They have a lot of time for things that aren't really necessarily beneficial. I mean, pretty much everybody's got Netflix or streaming services and they've been watched shows. And I'm not saying, I do that, but I also make time for exercise, right? Lack of motivation or interest. Again, exercise takes some commitment, and especially if you're going to make it a lifestyle habit, it takes some, again, you don't have to be a like all out, like trying to train for the CrossFit games or anything. Like, some people think that's pretty much, if you get an exercise, that's what it is. You're going to be like all out all the time, or like running marathons and things like that. It's not, and it doesn't have to be that, but having an active lifestyle, can be anything from, taking walks after you get home from work for, like you go walk for 30 minutes or an hour. And you just do that every day. I mean, it really is not huge. Now, again, depending on your health and how much like exercise your body needs and things like that, and especially how much non-exercise things you do throughout the day, you may need more than just walking for 30 minutes or an hour. But that's an individual thing, and again, just because you're doing that now doesn't mean you can't increase it over time as well if your body needs more, right? Lack of personal management skills or support systems. Again, I completely understand that. I've studied this stuff a lot. Now, again, my personality versus what I know in society is a little bit different, because I'm one of those, like, look, if there's something that needs to get done, you just get it done. Um, if you don't have good personal management skills, you need to create good personal management skills. If you don't have a good support system, then you do it without a good support system. Now, again, easy to say, and a lot harder to put into place, right? So again, there are skills, and that's the thing about being an exercise professional. You work with your clients to help them develop personal management skills. If they don't have a support system, you are now the support system for their exercise, right? And you help them find others to be a support system. Perceived lack of suitable resources. Again, man, all you need is a pair of shoes sometimes, right? And again, helping people to realize that, a lot of people feel like they have to go to a gym or have a gym membership or things like that, and that's great. I like gyms. Don't get me wrong. But sometimes that's not always the right place for everybody, and it may not be within their uh, budget or the realm of what they can get to a gym. It's sometimes creating exercise areas within the home or outdoor space, or doing things that people don't traditionally think of exercise, like maybe going and playing basketball at the local, like just at the local court, just like maybe a block down the road or something like that on a daily basis, can be the trick they need, right? Again, limitations from physical disability or chronic disease. Again, these ones, so the perceived lack of suitable resources, talking about, like, you go play basketball or whatever. Now, again, when you get down to this category, this is where we'd like you guys as good professionals to help them create environments that are safe and effective for themselves, or and again, sometimes some of these folks may always need guidance, right? It's a little bit different than typical personal training. Again, when typical personal training, I tell you guys, get them so coached up that they can take care of themselves. Basically at some point they become an expert that knows how to take care of themselves. You may have somebody that's mentally challenged, that may not ever quite fully understand how to take care of themselves. Therefore, they may always need your help or somebody like you to help them. And, that is fine. And that's a great, those are great clients to work with, and to get, to get into practice of working with those clients. And they're fun clients to work with as well. We've used to work at a school that had a program for clients that had disability. I mean, they had a gamut of disabilities, everything from mental to physical. Some of the folks had both, and the folks that worked with them, I mean, just absolutely loved working with them. And again, I would encourage any of you, if that's not a population you've ever worked with, even if you just go observe sometime and see working with those, you'll see why people love to do it. All right. So again, addressing inactivity in special pops, text provides specialized knowledge for dealing with special populations and exercise setting, including overview of pathology and pathophysiology of common conditions, and condition-specific recommendations for safe and effective exercise, including precautions and contraindications. Again, that's the big things. There's certain things that you need to be cautious with certain disabilities, and certain contraindications that you just don't cross those lines. Again, on top of that, you got to understand. So say, like say you're working with mentally disabled. So say you're working with Down syndrome, or Down syndrome population. You'll have some that are actually really athletic and some that aren't. You're going to have some that have a high capacity for certain things, like certain either sports or exercises and things, and some that don't. You got to understand it's the same thing with working with general population. It's going to be a very tailored approach. Now, again, there may be certain things that, like it's like, okay, for the majority, you're always going to do this precaution or contraindication, right? Again, if you work with spinal injury patients, again, there's certain things that you need to be very aware of, certain things that you're not going to be able to do, and so on and so forth. But again, it's going to be very tailored, depending on where the spinal injury is, depending on the person, their personality. So, I mean, you've got to understand that it's not cookie cutter, right? A lot of people think, oh, yeah, okay, so there's a formula you follow with like a type 2 diabetic. No, there's a formula you follow with somebody that's had brain trauma. No, there are certain recommendations. There's certain like rules that you do not cross in certain things. But again, besides that, there's an open gamut of things that you're going to work with them on and try and do. And again, if, like I said, you could exclusively work with Down syndrome clients, and you're going to find that each client coming in may be on a completely different program when you really look at it compared to the client you had an hour ago and the client you had 2 hours prior to that. And so again, it really is. It's, I always tell people they're, like they think in our profession, like there's like really, like there's got to be these protocols and spaghetti. I mean, it's really kind of the fun thing about being in the exercise field is that you have the knowledge of like, okay, I absolutely can't do this with this person, because of this, disability or whatever. But man, there's a million different things I can do with them, and they're going to be very different than the million things I'm doing with somebody that's got the similar issue. And that's what makes it fun. You look at some professions like, like nursing and things like that. They have specific protocols that they follow for every person that comes in with a similar issue. It's like, okay, you do A, B, C, and D. We don't do that. Right? There's just certain things we're like, okay, we can't do these 5 things, but besides that, we can do all these other things, right? So it kind of makes it fun. And you guys got to realize that. And again, when people ask me questions, they get frustrated because I can't give you specific answers. I'd have to say, all right, well, let me see this client. Let me talk to them and watch them and observe them. And then I can kind of help give you some recommendations. But here's the thing: a year from now, those recommendations might change drastically by what they've now learned and what they're able to do and what they liked and disliked of the previous exercise, right? So again, keep that in mind. Scope of practice: exercise professionals working with special populations are not licensed. So the scope of practice is determined by standards of care in the industry, right? So there's we don't have a license to work under, so we just have to look at, is this something somebody would typically do with a client with these particular issues, right? And that's what we go off of. Again, earned certifications ensure a certain level of specialized knowledge, so it shows that you've taken the time and gone through a class like this, got some knowledge, learned some skills to effectively deal with that particular special population. Scope of practice for exercise professionals, including conducting health appraisals, physical assessments, as well as designing and supervising exercise training. Again, there's certain things that it says, okay, with these folks, be careful with this, understand this, don't do this, so on and so forth. And then we just adhere by those things, right? And exercise professionals should not engage in activities presented as physical therapy or counseling. Again, you're not physical therapists and you're not, psychological counselors for them. Okay. Now, again, you may do some things that are similar to physical therapy. You may do some things that are kind of similar to counseling because you get folks that kind of talk to you about things and they may want your opinion and so on and so forth. And again, you just got, you got to explain to them, like, I am not a psychiatrist or psychologist, but, again, you're going to get in conversations like you would anybody else. Right. And so you just make sure that when you're talking in that scope, you're not talking as a professional, but talking as somebody who is now invested somewhat into their life. And you're like, this is probably what I would do, but you take that with what it is, right? But if they do need specific physical therapy help or specific mental help, then you need to send them to the right licensed clinician that can help them with those things, right? Um, Excluded activities for exercise professionals, diagnosed conditions, we're not allowed to do that. Again, people may ask you what you think is going on. And again, I always tell them, I'm like, look, you might have this, or this, based on your conditions. I know that these are the particular reasons for that. If you want to know for sure, you need to go to a doctor and have them give you an MRI or whatever, and they will then diagnose it, right? We don't do soft tissue mobilization. Gait training. Now, again, that's a little bit, it's kind of funny they put that in there. We don't do therapeutic gait training for things, but you can do more like performance improving gait training. Again, we do that with athletes, that have poor running habits and or things like that. But what they're talking about is more therapeutic. But yes, you will do gait training if you have folks that have really bad gait, from the standpoint of them having a physical disability. So somebody that may have some paralysis or some palsy or something like that. Not so much. If they just have bad habits, then yes. Neuromuscular education. Again, we do neuromuscular education in the fact that when you get them moving and lifting weights and things like that, it does do that. But again, what they're talking about is specific therapeutic. Again, I think they should have specified that in the way they did this slide, but that's what they're going for. And counseling for disordered eating or body image. We don't do that. And again, you can make the argument that most people have most people have some percentage of a disordered eating, and most people have distorted body image, but clinically diagnosed or somebody that should be clinically diagnosed, no, you do not. Okay. CSPS. So again, you guys hear me talk about the CSCS a lot. That's for strength and conditioning. This one is the CSPS, which is for special population specialists. Again, great certification to get. I would highly recommend it, especially if you want to work with special pops. Use an individual approach to assess, motivate, educate, train special pop clients of all ages regarding their health, fitness needs in collaboration with healthcare professionals, and design effective exercise programs and help clients safely achieve goals. Now, again, does the certification really, do you have to have it to work? No. If you work in certain areas where they have nothing but special pop clients, then my answer would change. They may require it, yeah. But in general, no. Okay. Nearly half of adults in the US have at least one chronic medical condition. Trends in folks getting older, this number will increase substantially in the next 15, 20 years. So there's a lot of opportunities to work with special pops. As lifespan increases, skills practiced by CSPSs are necessary to address quality of life issues and reduce burden on the healthcare system. True. Since many patients will be unaccustomed to exercise as a therapeutic activity, medical referrals can be an important source of clientele for the CSPS. Inclusive fitness is an approach whereby special pops can train in the same settings as others instead of exclusively in medical or clinical settings. Here's one of those things, and it's a quandary depending on the person. And again, you got to look at this. If somebody can work in the same class as just everybody else, I highly agree with this, and I think that's great. If it's two things. If you have a class that it's either no way or very, very difficult to modify it to be a safe environment for somebody that needs modification, and or by having, like an individual or a few individuals create such a great burden upon that particular class or instructor or instructors to which they cannot run an effective class for all people involved or for the majority of people involved, then at those points is when you might want specialized classes. Again, I think anytime that you can integrate folks with special populations into what we may call like a normal class setting. I think I encourage that, as much as possible. But sometimes it may be overburdensome or almost impossible to run a good class in doing that. And so because of that, we need to be aware of what's best for all parties involved, I guess is the best way to put that. Most, I guess, politically sensitive way to put that. And again, approach emphasizes increasing physical work capacity and health promotion in order to increase independence. Again, since benefits of exercise apply to all populations should have access to safe and effective exercise training. 100% agree with that. The Americans with Disabilities Act prohibits discrimination against persons with disabilities and requires reasonable accommodations to allow the pursuit of an active lifestyle in an integrative setting with other community members. Completely agree. And again, you got to look at the disability and like what you can add them in and can't, right? So again, look at the opportunities within the gym. What can you do? And again, you should be able to accommodate somebody. You should be able to accommodate everybody. Like a typical commercial gym should have a way to accommodate everybody. It may not be exactly the way that particular individual would like. And again, like I said, you have an obligation to everybody, right? And so you've got to again, these are sometimes tough decisions, and being mindful of the best way to go about these things and making the compromises that need to be made, right? Since the ADA of 1990 has exceptions to enforcement, the ADA standards for accessible design in 2010 address the specific structural requirements to ensure access. So again, having ADA bathrooms and ramps to get in and out of the facilities, so on and so forth. Standards generally do not include exceptions for smaller businesses of 15 or less employees. Again, small little boutique gyms and stuff may not have everything for everybody. And again, maybe you want to create a boutique gym that's made for special pops, right? Again, you want usable doorway levers or automated doors. Make sure pathways are at least 36 inches wide. I'm not even doing centimeters since most of you guys are dumb Americans like me. The only reason I'm good at the metric system, or I wouldn't even say I'm good, I'm proficient at it, is because I do so much crossover stuff and I have to read so much research from other countries and so on and so forth. Or like when I'm looking at race stats and things like that, I've had to get good over the years. But we so weird in the U.S. decide that we are going to have our own measurement system. I don't know. Anyways, 36 inches wide, 48 inches preferred, with wheelchair turnaround of 60 inches in diameter, right? 3 feet between all exercise stations, with 3x4 feet open floor space for wheelchairs to be parked without blocking pathways, and at least one available option for each type of training for each special pop, such as an arm ergometer for cardiovascular training. Again, there's a lot of really cool equipment that can be used by both folks that need ADA assistance and those that don't. And so there's a lot of cool equipment, like you can look at the free motion machines are great for everybody, because you can park a wheelchair in between and you can adjust the arms where they need it and so on and so forth. Other recommendations: increase access, increase staffing when necessary, mechanisms to assist hand grasp on certain devices. There's some wrist straps and stuff that'll lock in. So those that have maybe, like some palsies and some gripping difficulties and things like that. Lifting straps or other mechanisms to allow independent mounting and use of exercise devices, and stabilizing straps for those with limited torso control. Again, there's a lot of catalogs and stuff that you can go through that, like if you like you're going to accommodate all this. They'll show you the equipment you need and the accessories that you need and so on and so forth. And again, it's really not a whole lot of stuff. I'm saying this and it probably sounds like, oh, there's all this stuff you really need. There really isn't. You'd be amazed how many things that can be used to do these things. And really, a lot of times, the amount, like if you have a full-on gym, you'd be surprised how many pieces of equipment you can actually, they're somewhat ADA accessible. Other recommendations: they increase access, appropriately sized designed equipment for obese individuals or children. Seating for recovery in the training area, reduce noise and visual distractions for individuals with cognitive issues such as Down syndrome or autism. And again, that some of these things get hard, especially when you think of the visual distractions and stuff like that. Sometimes, some gyms like to have wild, vibrant things going on. That's the theme of the gym, so again, I think that's where there's a responsibility between folks that are wanting to bring in family members or friends and so on and so forth, where it's like, like some gyms just aren't, or there's areas of the gym that are just going to be like not the best areas. Again, if you have some of those cycling classes where they do the strobe effects and things like that, they just, it may not be a good idea for them to participate in those classes, right? But you can have other classes where you don't have that going on. So again, accommodation, right? Making accommodations, but not excluding some of the things that other people like as well, right? And trying to find that balance is key. Okay, so benefits of exercise for all populations are widely known, but not all populations will find it easy to participate. Again, this is where you guys come in and help out. Special POPs include those with specific conditions requiring training recommendations that differ from the general population. Again, most general population probably qualify for a lot of different special POPs you'd find out. And certified special population specialists have specialized knowledge to train these populations safely and effectively, including how to carry out training in inclusive manners. All right, that's all we got for today. I'll see you guys in chapter 2.